Increasing access and equitable distribution of the COVID-19 vaccine to those who are at risk and vulnerable from dying from the virus has become a top priority for many hospitals and health systems. In Texas, a partnership between Ascension and Community Care developed to do just that. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter for AHA. In this podcast, Rochelle Archuleta, Director of Post-Acute Care Policy for the AHA, is joined by Dr. Kimberly Avila Edwards, Director of Advocacy and External Affairs, and Jaeson Fournier, Chief Executive Officer at Community Care, about their collaboration to develop a successful mass vaccination campaign targeting the Latino community in Austin, Texas. Now to Rochelle.
Thanks, Tom, and thank you, Jaeson and Dr. Avila Edwards, for joining us today. We are very pleased to share your experience in the greater Austin area. I understand that through your initial 18 drive-through clinics, that about 50,000 vaccines were administered at the Circuit of the Americas Formula One track, and that each of those involved about 750 volunteers, including about 400 clinicians per vaccination clinic. Based on this tremendous experience, we welcome you to today's podcast. So let's turn to our first question. When your planning for a mass vaccination campaign began, what community needs and patient population were you striving to address? Dr. Avila Edwards, can you kick us off?
Sure. Thank you so much for the opportunity to be here. We really appreciate it. So recognizing that there were some underlying equity challenges that were present in vaccine distribution, the most important need we were striving to address was really equity in vaccine distribution. Really what this required was an alignment of the mission of all our community partners to serve this vulnerable population. And the specific patient population we were targeting as vaccine recipients at these clinics were largely people of color in some of the hardest hit parts of Travis County. We also targeted essential workers such as teachers from surrounding school districts and public transportation staff. And as we increased from our pilots to our kind of larger scaled vaccine clinics, we also included individuals from 3 other surrounding counties.
Jaeson, would you like to add to that?
I think Dr. Avila Edwards really communicated very well. The only addition I would have is, as part of our priority as a collective group of 6 partners with this mass immunization, was to really look at the zip codes within our area that had been hardest hit from and as a result of the coronavirus pandemic. And specifically, we looked at individual zip codes where the positivity rate had far exceeded the overall community positivity rate for testing as conducted. And as Dr. Avila Edwards indicated, that tend to disproportionately within our community, and as we've seen and observed across the country, adversely impacted communities of color, in particular our Latino population, where last summer we saw almost, for my organization, we saw almost a 1 out of 2, for every 2 tests, 1 out of the 2 tests came back as positive, so a 50% positivity rate.
Jaeson, can you please describe the logistical setup for the drive-through clinics? How did you decide on that methodology, the location, and other structural considerations?
Yeah, so great question. So logistically speaking, coming to and envisioning what a very large mass immunization operation would look like, and in particular a drive-through mass immunization, required the leveraging of multiple experts, be it through the local counties that are participating in their experts in terms of logistics and setting up the site, thinking about safety in terms of how folks egress with their vehicles into the site. Also inclusive was the presence and expertise of law enforcement to help guide traffic, And then coupled to that is just folks who are very mindful of putting up signage so folks are able to wayfind as they're coming onto a very large property. Coupled to that is thinking about how we protect our volunteers and the staff members that are out there from the elements. And one of the things that got set up was very large tents for which folks could drive through and under. And then also thinking about what the needs are at the point of inoculation. And so anticipating what are the supplies that are needed, how do we actually get rid of the used needles through biohazards? So all of this in and of itself really required us to be very thoughtful and deliberate in terms of how we wanted to position this. We were very fortunate. We leveraged in the local emergency operations center to help support that, as well as the large county here in Central Texas through Travis County to help coordinate a lot of that logistics. Early on, though, a lot of it was based on volunteerism through our partners at Ascension-Seton, which is a very large hospital system within Central Texas and within Austin, Texas. And within their structure is an emergency medical management group for which they actually brought expertise to plan for this. And so well in advance of the event actually being hosted the first time, were very sophisticated plans in terms of how traffic would come through, the total number of individuals that would be needed from both a vaccinator and support perspective, as well as taking into account what we would need from a logistic perspective in drawing the pharmaceutics out or the vaccines out of the vials that they come to us in, right? And so all of that was put into play. So some very solid planning in advance, but then execution thanks to so many that have been involved.
Dr. Avila Edwards, can you speak about the role that volunteers played in the drive-through clinics and your recruitment, and specifically how that helped you link to the Latino community in and around Austin?
Sure. I would like to add a little bit to the previous question, because the one thing that I think made such a difference was everyone's willingness, whether it was emergency management, our partners at community care, Ascension volunteers, was their readily enthusiasm of pivoting and constantly looking at process improvement, especially early on with some of the pilot clinics, so that being efficient and modifying our plans in real time was definitely a goal of everyone. So I just really think that was so critical. But in terms of volunteers, gosh, volunteers were so critical in the execution of our vaccine clinics. We recruited pharmacy, clinical, and non-clinical volunteers. And the pharmacy volunteers were recruited from our health care institutions, and I think community care tremendously for bringing a lot of those individuals in. Our partners at Ascension in pharmacy, as well as community partners like a local grocery chain called HEB, were also wonderful partners to have. So we were very grateful to have that pharmacy support with knowledgeable individuals. And we also relied on our emergency service staff for some of that pharmacy support. In terms of non-clinical volunteers, we recruited from our community. We had, I think, over 150 local community groups and members, like the AFL-CIO, city council members, school district staff, and so many others across Travis County show up to volunteer, to check people in, to help complete paperwork, to help direct traffic. And in terms of our clinical volunteers, initially they were recruited from Ascension-Seton, Dell Children's Medical Center, and Dell Medical School Pediatric Department. And I think for me personally, it was so striking to see such a response to our call for volunteers be answered as quickly as it was, within 12 to 24 hours. And I think what this speaks to is a true desire and really a yearning to contribute to the prevention of COVID-19 and the prevention of every individual through every vaccine given, meant that those potential individuals would not be in our hospital. And I think this was a big motivator for a lot of people. You know, and I think it was noted, not limited to, but very prominent in our pediatric providers. We've all been burdened by COVID-19, but I think the pediatric community has not, as much as our adult colleagues. And there was a very palpable desire to have that immediate response and willingness to help decrease the burden of this infectious disease for our adult colleagues and our community as a whole. So we had multiple volunteers return from multiple shifts because they understood that the work they were doing was decreasing disease burden. In terms of how that and what that meant for outreach to our community, it meant the involvement of trusted voices. You know, I appreciate community care reaching out to their patients. To have that trusted voice and relationship to bring those individuals into the vaccine clinic was critical to serving the population that we wanted.
Thank you. Jaeson, would you like to add to this question related to volunteers and specifically about how some of the economics played out for your staff?
Yeah, I think core to our ability to provide the vaccines through the mass immunization clinic through today and into this upcoming weekend as well has been the ability to garner support through volunteers who are willing to give of their time to advance equity to the distribution of the COVID-19 vaccines, but also for us to actually go ahead and be able to take the most potent preventative measure that we have available to us in our battle against the coronavirus and actually getting into arms, right? And so, but with that stated, we also recognized on our side that one of the ways that we could directly go ahead and support this most important initiative, especially given that there was an emphasis on the underserved communities that community care serves and is so privileged to serve, was actually recognizing that we need to have some of our staff on site. And so we stepped up and actually paid for our staff, be it through overtime or by adding staff to support the efforts, which we think was important, not only for our contribution to the efforts, but also to make sure that we were well positioned to deliver on the objectives that we have had from the outset in terms of equitable distribution of those vaccines.
We've heard throughout the podcast your references to community partners and the unique elements that Ascension and community care brought together as a large health system partnering with a community health center organization. I was hoping to hear both of you shed light on why you think this partnership was so successful in responding to COVID-19 vaccine needs. And we can kick off with Jaeson and then turn to Dr. Avila Edwards.
Yeah, sure, Rochelle. So I think, first and foremost, a long-standing collaborative relationship with Ascension Seton as a large hospital provider in our area predated coronavirus. And so there's a natural alignment with our mission for them as a Catholic hospital system in our area who have for decades looked at as part of their core mission and core values to ensure that folks within our community who just simply have less or who are uninsured can access their care. There is a natural alignment along that line with what we do as a community health center. And then you couple that to the fact that when we looked at the distribution of vaccines as they were starting to flow into our community across the country, that there was a disproportionate amount that was not being levered towards communities that had been hardest hit. And so as a result, there was a natural tendency for us to come together to place emphasis at those that have been most adversely impacted by the pandemic, but also still those most at risk from the pandemic itself. And then coupled to that, and we'd be remiss if we didn't say this, is this very strong leadership from the county judges. There are 4 counties that are involved who recognize that for their constituents, this was extremely important. Starting with our immediate judge here in Travis County, Judge Brown, who is willing to reach out to his peers in immediately adjacent counties. So he's with Travis County, and then adjacent counties, Caldwell County, Hayes County, and Bastrop, and representing to political stakeholders that there was a bipartisan effort that was targeting to get vaccines to the hardest hit communities for the pandemic, and actually being able to receive additional vaccines into our community towards this effort. And they were able to point to the relationship between community care and Ascension Seton to be able to actually deliver those vaccines into the arms that they were intending to have them delivered. So I think it's a collaborative of 6 that came together with the right intent in mind. And that, frankly, is what's guided us all the way through. For a large hospital system, to partner with us is not unique. Because we do it all the time with our partners at Ascension Seton. So this was just, and it continues to be a prime example of how our collaboration continues to evolve in service to the communities that we're proud to serve.
Turning to Dr. Avila Edwards, is there anything that you'd like to share to your hospital leadership peers on the benefits and unique strengths that community care brought to this effort as a well-regarded and committed community health center?
I couldn't agree with Jaeson more that this has been a long-standing partnership that just we built on the strength of that. And I think as I look at our collaboration and our partners, we all brought strengths that may have been weaknesses that the other just helped fill. So when I think about community care, I'm so grateful for them, for their experience, for their knowledge of being the vaccinator of record, having that pharmacy experience in terms of the efficient drawing up of vaccines. As a healthcare system, we were able to support them, but they supported the entire effort through the platform of scheduling and allowing the registration of our community members. And it was a very holistic approach where, again, what our system may have not had in place to put this effort in a functional capacity was definitely filled by the other partners.
Thank you. Certainly the personal dedication of your local leaders is shining through. Based on your tremendous experience in the Austin area, how are you putting your COVID vaccination lessons learned into action for the remainder of this pandemic, as well as in anticipation of future local emergencies? Dr. Avila Edwards of the Ascension Health System and Jaeson Fournier of Community Care Community Health Center, we will continue to cheer you on as you host even more drive-through clinics that have vaccinated tens of thousands of Austin's Latino and other communities. We thank you and support you.